This is Dr. Allison Taylor, a practicing OB-GYN. She is joining me here today at the Hugo Medical Clinic. She will be answering a few questions I have prepared over miscarriages induced by drugs and alcohol. So, what are the initial steps you take to prevent a miscarriage once you have confirmed patient addicted to recreational drugs or alcohol?
Probably, obviously, the first thing that you would try to do is get the mother to stop using drugs. It's not, we don't necessarily do a drug screen on every single brand new OB patient, but if we have an index of suspicion, if we have a reason to think that she might be on drugs, we would do a drug screen. Unfortunately, there are not any preventative measures that we can do that will prevent miscarriage other than not doing drugs. If she's a smoker, we can encourage her to stop smoking, encourage smoking cessation, because that increases your risk for having a miscarriage as well. But there's not really any medical things we can do to prevent a miscarriage.
Okay. What are the most prevalent recreational drugs that you have seen cause miscarriages in your practice?
So it's hard to say that drugs specifically cause miscarriages, but what we would know, quite frankly, amphetamines, cocaine, or tobacco would be the top three things that probably would most likely cause a miscarriage.
When women have a miscarriage due to recreational drugs or alcohol, what term is a woman most likely to have a miscarriage?
Well, interestingly, the word miscarriage actually refers to a pregnancy loss that occurs before 20 weeks. Because after 20 weeks, if you lose a pregnancy, it's not technically a miscarriage. Lay people will say miscarriage, but the honest to God clinical term is that after 20 weeks, it's no longer a miscarriage. It is either an intrauterine fetal demise, so it's not a technical miscarriage. What was the actual question? What was your question?
When women have a miscarriage due to recreational drugs or alcohol.
What would be the most likely trimester for it to occur? It's hard to say. It's fairly classic for us to have, let me just rewind a little bit. It's not common for people to have a pregnancy loss at term after the baby would be viable, when you have a normal sized baby. That's pretty rare. However, when we have a patient that comes in with that, it's called an intrauterine fetal demise. It's always devastating, but one of the first things that we think is she on drugs? Because it's not uncommon for people that are on methamphetamines, people who are on cocaine, to have that. So if you have a pregnancy loss in the third trimester, it is far more likely to occur in someone who is using drugs. First trimester pregnancy loss, I don't know that I can say that it would be really likely for someone to lose a pregnancy in that trimester.
Okay. What steps are taken once a woman has a miscarriage due to recreational drugs or alcohol? Is the woman reprimanded by law? Is she sent to rehab?
Well, rehab is a person, you can't get sent to rehab. Do you know what I mean? You have to choose to go to rehab. If you're using drugs that are illegal, you're certainly subject to prosecution by the law. Now, if you have a baby, and this is a little bit beyond the scope, I deliver the babies, and then once the babies are delivered, I hand them off to the pediatricians. If a baby is born to a mother, and the mother is positive for drugs, she is certainly subject to CPS taking her baby. They are very likely to take their baby. And even if a mother, if she has a negative drug screen, because things like amphetamines are metabolized really quickly, so they're out of the mother's bloodstream, they screen those babies. They take the baby's urine and the baby's first meconium, and they screen those babies for drugs. And if those babies come back positive for drugs, absolutely, CPS takes them. It is unfortunately incredibly common in Choctaw County and McCurtain County and Bryan County, which is where the bulk of our patients come from. It is unfortunately very, very common to see people who have positive drug screens and babies taken away because of it. Quite frankly, that's the pediatrician's jurisdiction. Once we deliver the babies, it's up to them. But it's common if the nursery nurses or the pediatrician has any reason to have an index of suspicion to screen mothers. And some doctors, some of my colleagues screen every single new OB patient that comes in for drugs. So once you're screened, it does sort of like raise a red flag for CPS. And once a person has a positive drug screen, CPS will investigate things, try to make sure either it's a fluke that their drug screen was positive, or make sure that they're not doing something that would harm that child and or their other children.
Okay.
Okay.
That's all.
Okay.
Thank you.
Oh,
Dr.
you're
Sam.
welcome. You're welcome.